All right. Happy Monday, everyone. I hope you had a great start to your week. I'm Dr. Monica Tillett, Doctor of Physical Therapy and the owner of New Direction Rehabilitation and Wellness. And for those of you who aren't familiar with what we do at New Direction Rehabilitation, we help the seniors in our community, 65 and over. We help them stay strong, avoid falls, maintain independence at home. And we have recently added speech therapy services to our list of services. So I wanted to take a minute to introduce Miss Mileen Woods, who is our speech language pathologist, and wanted her to tell a little bit about herself and exactly what it is, because most people aren't aware of what speech therapists do. So, Mileen, I'm so excited to have you a part of our team. And so, if you could just introduce yourself and tell everyone a little bit about you.
Well, my name is Mileen Woods. I am a speech language pathologist. I graduated from UNCG, the University of North Carolina at Greensboro, about 10 years ago. Um, I chose speech therapy because once I graduated with my bachelor's degree, I wanted to pursue something a little bit more meaningful. So I decided to research speech, and I decided to get my master's at the same school at UNCG.
Awesome, awesome. UNCG is a great school, and they have a great program there. So, after your decision to become a speech therapist, was there anything else that was deciding factors in that, or was that the main reason?
No, well, I was kind of torn between law school and speech, but it was I had some, young and I had children. So I kind of, my niece was actually getting speech therapy. So I watched her progress and I decided that's what would be more meaningful for me, where I would make an impact in other people's lives in that field in speech.
Mhm. That's awesome. So we often hear the words speech language pathologist and speech therapist, and they're used interchangeably sometimes. But is there a difference between the terms, and what is the most appropriate term, I guess, we should use for your profession?
Well, speech therapy and speech language pathology, they're both interchangeable, but SLP, speech language pathology, is more preferred just because it encompasses more of the language component to what we do, as well as the speech. So it involves both. When you just have speech therapy, people kind of look at, oh, are you my speech teacher? Or, there's nothing wrong with how I talk. But because the scope of practice for speech language pathologists is so involved, that it does entail way more than just learning how to talk right or your articulation.
Mhm.
It deals with, understanding. How do you understand? You know, it even involves swallowing. So it has a lot of different components to what we do.
Mm-hmm. And that's a great leeway into the next question as far as, what type of diagnoses do you typically see and how do you help them?
Okay, a lot of at the present time, primarily what I am, the type of clients that I'm working with, they have dementia, so we deal with a lot of cognition, in regard to helping with memory strategies, training staff, training family, problem solving, some of those higher level executive functions that involve sustained attention, divided attention, also a lot of swallowing. The term that we use, the technical term that we use for it is dysphagia. So swallowing, of course, could result from someone that has dementia. They just, as they progress on with that disease, the brain doesn't allow them to process on what to do or remember what to do. And then also there are those patients that have strokes, that have to need speech therapy because their muscles are not functioning, their swallowing muscles are not functioning the way they should in regard for them to have safe intake with regular solids or even pureed consistency, and then liquids, or whatever the consistency for the liquids is, or just safe overall intake with food and liquid.
Mhm.
So,
Awesome, awesome. And I know that we see a lot of patients with Parkinson's as well, and speech therapy can help those patients also, right, Mileen?
yes, ma'am. Yes, ma'am. So what we do, a lot of times with patients that have Parkinson's, we of course we like to make the proper recommendations if they need to have some type of instrumental to make sure, look at their vocal cords, see, make sure there's no polyps or not anything like that, any kind of vocal abuse or deterioration of those vocal cords. Also, what we do, we also work on conserving energy, all right, for them to communicate, and we work on different techniques and strategies in order for them to communicate with their speech in regard to like whatever their needs are, getting their needs met to with their family or care, whoever the rehabilitative staff is or care family members. So that's the different kind of things that we do,
Mhm.
but not limited to those things.
Mhm. Mhm. I know one of the common complaints from my patients with Parkinson's is their low voice, and um, it frustrates them so much. And that's one of the things I know you guys help them with, strengthening that voice quality. And it just really is, it's just so beneficial, just all around speech language pathology. I actually, I've always wanted to be a physical therapist, but as I started my working in like skilled nursing facilities, and I was around speech therapists, I was like, man, I really like that field. I think I could do that in another life. But then I started thinking about all the intricate things that you do with the mouth, and I said, that's not my strong suit. So I should stay with physical therapy.
Yeah, and definitely in regards to Parkinson's, we definitely the the main goal is to have the client or the patient maximize communication. And again, like you said, the loudness is definitely affected where they're hard to hear, and therefore a lot of times you see that they stop communicating because they're not understood or they can't be heard, and they have a lot of interruptions. It could be a family member, it could be a friend, they try to interrupt or get their words out for them. So it's almost like a depressing state where they're in sometimes, because when you lose that ability to communicate and kind of speak for yourself, you know, is like, what do I have left sometimes? That's just some of the comments that I've heard through my experience as a speech therapist working with patients with Parkinson's, you know.
Yeah. So, what would you feel is your favorite thing to treat? Because you've been treating for a while. Was it
That is a long
19
time.
years, 20 years?
No, man, not that long. It's been 10 years.
Years.
But some of my favorite, I mean, I love all the services that we provide as speech therapists, but some of my favorite is voicing, is aphasia therapy, cognitive therapy, and then of course dysphagia. Those would be probably my four
Hmm.
that I really like.
And for those who don't know what aphasia is, what is that?
So aphasia results from most commonly from someone that has a stroke. So there are different types of aphasia. Um, One is global aphasia, which is the most severe aphasia, and that's whereas most clients, they lose the ability for that expressive and receptive language. So lose the ability for expressive, just talking, and the receptive for understanding. So then you have to try to utilize the best way for them to have meaningful communication. And a lot of that is through like nonverbal, or if they, depending on how much receptive language they have left, if they can use like a computer-based technology assist, augmented alternative communication device to help them communicate. So that's just one. And then some of the other aphasias deal with word finding. Okay, they have fluent where they can say sentences, but it doesn't have any meaning to them. And then it's that non-fluent aphasia where you have your words are just broken up like in bits and pieces, those kind of things. So it definitely affects the way you communicate, both expressively and receptively. So
Mhm. And I know earlier you mentioned what dysphagia was, but sometimes people think that it's normal, like the different things people experience during dysphagia is normal, like coughing and choking and things of that nature. So could you tell us a little bit about when someone, if they're experiencing those symptoms, should seek additional treatment, like from a speech language pathologist?
a lot of times, and I'm going to just go back a little bit to the Parkinson's, because a lot of times when people have like more of the advanced Parkinson's, they do have the swallowing associated with it, where they have the difficulty with chewing, the difficulty with pushing the food back, food, or even the sensation of food getting stuck. They have that frequent coughing, that wet, gurgly, like you're gargling vocal quality. So those kind of things in regard to Parkinson's. But in general, now occasionally a normal, like you and I, without any kind of medical issues, sometimes we do get like a little choked up. We might be talking, or food might go down the wrong way, but it's not consistent. Now, when you have a patient that consistently is coughing, it can be before the swallow, it can be during the swallow, or even after the swallow, even 10 minutes after, 30 minutes after, and it's frequent, it's consistent, they need to seek medical attention for that. Or if they're complaining that the food is just not going down, it just feels like the food is getting stuck. Or if, as well as if they stop eating, they're not eating because of those things that are happening, the coughing or the choking pretty consistently, or their eyes are just watering up when during the meal, or their nose is constantly running during the meal. Our nose runs sometimes when we have occasional seasonal allergies. But
Mhm.
when you look at with someone's intake with their food or their liquid, they need to go ahead and seek attention for that. Don't wait, because you don't want anything to go down the wrong way, and then it becomes more of a problem for them.
Because
Sorry,
that
that
can
was
even
nothing.
cause pneumonia, correct?
Exactly.
Mhm.
Yes, aspiration pneumonia. So if you sense or you have any kind of symptoms in regard to swallowing issues, like we mentioned, and but not limited to, you want to go ahead and get attention to it, because it can just, even that one time, they can go ahead and aspirate, and then the food or liquid or both can get into their lungs, and then they'll be really sick.
Yeah. Well, I tell you, Mileen, this has been so informative, and I know those who will be watching this, it will be very helpful to them as well. So, is there anything else that you would like to add?
I would like to add that, you know, in regard to anything that a family member or a caretaker notices, even if it's with, you know, she's just not remembering as much, or she's forgetting this, or even those frequent falls, to go ahead and notify the physician so they can get evaluated, and then they can go ahead and direct them to your services, or the proper services for them to get treated. Because a lot of times what happens, and this is just through my experience, um, you have a lot of family members, you know, that leave their mother or father or whoever it is in the house, and over time things are happening and they just think it's just kind of normal. Oh, well, we won't worry about it. But I just really want people to advocate for awareness, to know that any kind of changes, to go ahead and just seek assistance for medical assistance for that.
That's right. That is a great, great point. Let me make sure, because I can't see any questions or anything
Okay.
on the screen that I'm in, but I just want to see if there happens to be any comments. Because I can't see. Okay. No comments. But if you guys have any additional questions, feel free to leave them in the comment section. Or if you feel like you or a loved one needs speech therapy services, then please give us a call here at New Direction Rehabilitation and Wellness, and that is 336-283-5028, and we can work with your physician and to help go ahead and get some services set up for you. Thank you again, Mileen. So excited to have you part of the team. And I know you're going to be a great asset to our clients. You're welcome. You're welcome. All right.